We would like to share the results of a community assessment on Midland, Oregon, conducted by Michael Holstrom, Cindy Rice, and myself, Caitlin Ironside. Midland has a rich history based in livestock and agriculture. The town was established in 1908 as a railroad shipping yard, the second largest in the state. At its peak, Midland boasted a one-room schoolhouse, 2 general stores, a library, a grain warehouse, livery stables, and a hotel and saloon, as well as numerous holding pens for cattle and sheep. As additional railroads were developed in the 1920s, Midland dwindled until the 1950s, when new growth occurred with several hundred people moving to the area. This small community is located 5 miles south of Klamath Falls and is surrounded by farmland and wildlife habitat. It is bordered on the west by Highway 97 and the rail lines. The rural setting and ability to have livestock are key attractions to the area. Midland has very limited industry, and as such, most residents work in Klamath Falls and the surrounding areas. A post office, convenience store, and auto repair shop currently operate in the community. Residents also benefit from a community-operated hall and park. With the exception of the post office, there is no government agencies or schools. No public transportation is available, and while Klamath County Fire District No. 1 provides emergency services, the community does not have fire hydrants, and response times can be lengthy due to distance traveled. Law enforcement is provided by the Sheriff's Department and the Oregon State Police. Other services such as fuel, laundry, medical care, pharmacy services, restaurants, and grocery stores must be obtained in Klamath Falls. Our secondary data source is the 2010 United States Census Bureau statistics. There was limited information available specific to Midland, with only age, race, income, and household size data available. According to the census, the population of Midland is 212. The median age is 44 years, and there are 86 households of 92% of Midland residents are white, with the remaining percentages reporting Native American or a combination of 2 or more races. Midland is not an incorporated town and lacks governing structure. Because of this lack of formalized structure, we distributed door-to-door surveys to 95 houses instead of utilizing focus groups for feedback. We received 21 survey responses. This represents a 22% return rate. Our primary data is taken from our survey results, key informant interviews, personal observations, and informal interactions with residents. A return visit was made to each house for follow-up and to express our appreciation. Homes in Midland demonstrate a wide range of styles and ages, dating from the early 50s to the late 70s and early 80s. All homes appear to be single-family units. The level of community in Midland is rated as very high and is considered to be a strength by residents. According to the U.S. Census, the median duration in a residence in the United States is 5.9 years. The median length of residency in Midland is an impressive 23 years. This represents a significant increase above the national average and clearly demonstrates the stability of this community. A significant percentage of residents indicated they felt Midland to be a very safe community. While specific data was not available from law enforcement agencies, they indicated a low call volume to this area. Students are bused approximately 12 miles across the Klamath Basin to the Henley schools. Comments pertaining to the schools were predominantly positive with no specific complaints. Midland has approximately 44 school-age children, who comprise about 21% of the population. Although the only store in Midland is a convenience store stocking mostly snacks, beverages, and emergency staples, residents reported excellent access to healthy foods. 81% of survey respondents have health insurance, and 76% rated access to primary health care as excellent or good. Midland is 10 miles from Sky Lakes Medical Center and many medical and dental offices. The nearest pharmacy is 5 miles away. Residents generally reported high satisfaction with their community. However, they did see areas for improvement. There is a small community-owned park and community hall, which provide outdoor activity space and a communal meeting facility. Residents reported that both of these assets would benefit from some maintenance, including improved lighting and additional equipment such as benches or picnic tables. They also identified significant needs for community support and funding. Many indicated a desire to see the use of these facilities expanded with the addition of community events. It is also noted that none of the streets have crosswalks or sidewalks, and very few have streetlights. Many streets lack paving. The lack of paving was not reported as a community concern, but there were requests for installation of these important features, particularly street lighting. Finally, a recurring theme we heard from small communities in Klamath County is the lack of access to specialized health care. Midland residents share this concern and made specific comments about the need to recruit and maintain specialists. Feedback from residents was overwhelmingly positive. In our conversations, we were told that Midland is a great place to live, and while they could see room for improvement, they appeared deeply committed to their homes. The rural way of life offered in Midland, combined with the convenience of its close proximity to Klamath Falls, seems to be the best of both worlds for these residents. Our thanks to everyone who helped with this project. We especially appreciate the support of the Midland residents who took the time to talk with us and fill out our survey. Thank you.